High-Yield Immunology and Serology Review Part 2 by Happee RMT. Number 1. Protection from smallpox could be generated by the transfer of pustular material from cowpox lesion instead of the more hazardous smallpox lesion. A. Edward Jenner, B. Louis Pasteur, C. Jules Bordet, D. Robert Koss. Answer is A. Edward Jenner. Number 2. Suppose an individual develops antibodies in response to a streptococcal pharyngitis infection. This is an example of A. Passive immunity, B. Adaptive immunity, C. Active immunity, D. Natural immunity. Answer is C. Active immunity. Number 3. An RPR test done on a 19-year-old woman as part of a prenatal workup was negative but exhibited a rough appearance. What should the technologist do next? A. Do a VDRL test, B. Send the sample for confirmatory testing, C. Make serial dilutions and do a titer, D. Report the result as negative. Answer is C. Make serial dilutions and do a titer. Number 4. False positive non-treponemal tests for syphilis may occur because of which of the following? A. Infectious mononucleosis, B. Systemic lupus erythematosus, C. Pregnancy, or D. All of these. Answer is D. All of these. Number 5. Which test is recommended for testing cerebrospinal fluid for detection of neurosyphilis? A. RPR, B. VDRL, C. FTA-ABS, D. Enzyme immunoassay. Answer is B. VDRL. A positive VDRL test on spinal fluid is diagnostic of neurosyphilis because false positives are extremely rare. Number 6. A patient with a deficiency in complement component C7 would likely present with A. Recurrent staphylococcal infections, B. Recurrent neisseral infections, C. Recurrent Escherichia coli infections, D. Recurrent nocardia infections. Answer is B. Recurrent neisseral infections. Number 7. Recurrent periodic fevers may be associated with increased production of which immunoglobulin? A. IgG, B. IgM, C. IgD, D. IgE. Answer is C. IgD. Hyper-IgD syndrome, also referred to a periodic fever syndrome and Muckle-Wells syndrome. It is caused by a deficiency of mevalonate kinase, an enzyme involved in a stereosynthesis pathway. The syndrome has been seen primarily in Northern European populations. Number 8. A woman with breast cancer is treated with a monoclonal antibody to HER2. This is an example of A. Passive immunotherapy, B. Active immunotherapy, C. Cancer vaccine, D. An immunotoxin. Answer is A. Passive immunotherapy. Number 9. What clinical manifestation would be seen in a patient with myeloperoxidase deficiency? A. Inability to produce IgG, B. Defective NK cell function, C. Defective neutrophil function, D. Defective T cell function. Answer is C. Defective neutrophil function. Number 10. Characteristics of a bacterial capsule include which of the following? A. It is an important mechanism for protecting a bacterium against ingestion by PMNS. B. It is what causes bacteria to stain as gram-negative. C. It cannot be used for vaccine development. D. It is composed of peptidoglycan. Answer is A. It is an important mechanism for protecting a bacterium against ingestion by PMNS. One of the most important features of a capsule is its role in blocking phagocytosis by WBC. Number 11. The best use of serum tumor markers is considered to be in A. Initial diagnosis of cancer, B. Determining patient prognosis, C. Screening for cancer, D. Monitoring patients undergoing cancer treatment. Answer is D. monitoring patients undergoing cancer treatment. Number 12. The only blood group system that affects clinical transplantation is AABO, BRH, Sickle, D. Duffy. Answer is A, ABO. The ABO system is the only blood group system that affects clinical transplantation. Number 13. Antimitochondrial antibodies are strongly associated with which disease? A. Autoimmune hepatitis, B. Celiac disease, C. Primary biliary cirrhosis, D. Goodpasture syndrome. Answer is C. Primary biliary cirrhosis. Number 14. Antigen receptors on T lymphocytes bind HLA class II peptide complexes with the help of which accessory molecule? ACD2, BCD3, CCD4, DCD8. Answer is C, CD4. Number 15. Which of the following would be considered a significant finding in Graves' disease? A. Decreased T3 and T4, B. Anti-thyroglobulin antibody, C. Increased TSH levels, D. Antibody to TSH receptors. Answer is D. Antibody to TSH receptors. Good job for finishing! See you on the next review!